Welcome, and thanks for viewing this program excerpt from Action Training Systems. All the training objectives included in this program are listed on the screen. The following video is a short sample from the program. A complete listing of our training products is available on our website.
Hand hygiene is the most important infection control practice to break the chain of infection. Before and after direct contact with patients, wash your hands with plain soap and warm running water. Avoid routine use of antibacterial and antimicrobial products. First, wet your hands. Apply the product amount recommended by the manufacturer. Rub your hands vigorously for 15 to 20 seconds, covering all surfaces of the hands and fingers. Pay close attention to nails and the skin between fingers. Rinse your hands and dry thoroughly with a disposable towel. Use the towel to turn off the faucet. If your hands are not visibly soiled, or if hand washing facilities are not readily available, an alcohol-based hand rub is an acceptable alternative for routine decontamination. Alcohol rubs that contain at least 60% alcohol are effective agents for reducing bacteria and viruses. Apply the amount recommended by the manufacturer and rub your hands together. Cover all surfaces of your hands and fingers and rub until your hands are dry. Even after decontaminating with an alcohol-based hand rub, you should still wash your hands as soon as soap and running water are available.
Thank you for viewing this program excerpt. For more information about the full line of over 200 course offerings and other training materials available from Action Training Systems, please visit our website at www.action-training.com or contact us at 1-800-755-1440 extension 3.